Keeping with Capitol Hill, a historic shift may be underway for U.S. drug policy. Good morning and happy Wednesday. The U.S. Drug Enforcement Administration, or DEA, is moving to reclassify marijuana as a less dangerous drug. And here's what that means. Drugs are all separated into what federal government calls schedules. They're just a different way of saying categories, and there's 5 of them. Right now, marijuana is a Schedule I drug. Now, that's the same category as LSD and heroin. The DEA wants to move weed to Schedule III instead. This potential change could allow pot to be treated like ketamine or certain steroids even. The proposal recognizes using cannabis for medical reasons, and it also acknowledges that this has far less potential for abuse than other drugs. As far as widespread rules on that recreational use, though, that door isn't open. At least not yet. Schedule III drugs are still controlled substances, and illegally buying or selling them can still put you behind bars. And then here's more insight on the process as well. So this change still needs to be reviewed by the White House. If approved there, the Federal Health and Human Services Department is then going to hold a public comment period and a legal review. The policy change comes at a time where thousands of Americans remain behind bars for nonviolent marijuana charges. Meanwhile, President Biden has previously called for a review of the federal marijuana law back in 2022. He's also pushed state leaders to erase some of those marijuana convictions. So not only could this move have some pretty significant legal implications, it also impacts the ability to research cannabis and impacts the industry as a whole.